So, hey Deb, how are you?
I'm really good, thank you very much.
Awesome. You're looking healthy as ever.
Thanks.
So I just want to take a minute and ask you a few questions and share with people a little bit about your experience here at Ally Spine Center, because our brand of chiropractic is so different. So if you wouldn't mind sharing, why did you come in, what was going on, why did you think you needed help, and what did you learn from our assessment?
Well, you know, serendipity is one of my favorite words, and that the stars kind of aligned when I finally met you, because I do a lot of work on the computer by nature of what I do for a living, and started noticing that I was having issues with my neck.
Okay.
And not a big deal. I go from the computer to my hobbies, which were like knitting and trying to play the guitar. So I just was constantly hunched over all the time. So I'm like, that's normal, I understand that. But then it started radiating down my arm a little bit, little numbness in my fingers. And I can remember starting to think, you're going to have to do something about this. But I wasn't quite sure what it was. And then I met you, and I started hearing you talk about corrective care. And it just made so much sense to me. And you had that great new patient special going on. I thought, what do I have to lose? Nothing. So I came in, you took the x-rays, you showed me right where the problem was, and I just signed up for the protocol, and I'm so glad I did.
All right, awesome. Well, thank you. I'm so glad you did too. And we're trying to just let people know that there really is a difference between palliative relief-oriented care versus the corrective care. And certainly we want everybody to feel better. No one comes in saying, I feel great, I just want to stay that way, right? I mean, that would be ideal, but everyone has a symptom usually that drives them. And then we're saying, okay, well, what's really the cause? And so the exam, the x-rays show that, tell that story, and then the process of correction is unique. Can you talk a little bit about what that was like for you and what we did, utilizing the adjusting techniques and the decompression, that kind of stuff?
Well, I'm not going to lie, the first couple of weeks was a little bit rough, only because my spine had started to curve abnormally, and you were in the process of putting it back where it was supposed to be. So there was a little discomfort involved with that manipulation. But the spine med table, then laying on that, I can remember, and I think all of us have that, when you move your head and it's a little bit, you feel that little gravelly kind of movement, you can kind of hear it in your ears. I don't have that anymore, and I wouldn't have it after I got off that spine med table. I felt taller, like a couple of inches, and you gave me some things to do at home, and all of that together. Now I just really enjoy coming. I look forward to it.
That's so great. And so the level of discomfort, would you liken that to the feeling that you might get, say, maybe you did a new workout routine and it was a little challenging, a little uncomfortable, but wouldn't be necessarily painful?
It wasn't painful. I wouldn't say it was painful. It was uncomfortable, and I would say a new workout routine is much worse. I mean, I think it's a great thing that you brought up, though, because I think a lot of people have a little, especially if they've never been to a chiropractor or gone through a corrective process, they're thinking, oh my gosh, well, what if it makes me worse? Or is it going to hurt? Or all these questions, right? So we're really careful about the techniques and the technology that we use, so it's as comfortable as it can be. Certainly nothing more challenging than like when I was a kid wearing braces and they would tighten down the braces. It would be a little uncomfortable because it's a challenge. But then the next thing you know, a couple weeks goes by and you feel terrific. And then really the underlying condition is improving. That's the goal. That's the perfect analogy with the braces. I had the braces. I understand that. You tighten them a little bit and it was uncomfortable for a while. It's exactly what it was like. And the thing was, I knew at my age, health is wealth. And the older I knew I was going to age, and the best investment I could make was in my health. And I'm so very glad that I met you.
Well, thank you so much. It's been our pleasure, and you've been an ideal patient. We really appreciate you and your effort, and you've told a lot of people about us, and we're grateful for that too. So thanks for everything.
My pleasure.
Awesome.